You know, that quote right there, it is an absolute paradigm shifter. It completely rewrites the playbook on how professionals, educators, and honestly even families need to communicate about recovery today. For the longest time, the addiction treatment field was primarily focused on what it wanted to say, right? Building campaigns based entirely on its own internal assumptions. But while they were doing that, this quiet revolution was happening in the background, literally altering the baseline of how people hear and interpret information.
And that brings us to this crucial reality. The counseling relationship now begins inside a conversation that is already underway. So think about it. Before someone ever steps foot in a clinic or makes that incredibly hard first phone call, they've already been trying to make sense of their struggles through this vast, wild digital landscape. They aren't just arriving as blank slates waiting for a doctor to hand them a definition of addiction. No way. They're showing up with definitions already locked and loaded, built from hours of interacting with online spaces designed for speed, recognition, and emotional reaction.
Welcome to this explainer on ClearBound's Addiction Conversation Report 2026. You can really think of this as an essential intelligence briefing for anyone working in or navigating the modern addiction field. Now, to be clear, our goal today isn't to evaluate treatment effectiveness or debate clinical standards of care. What we're doing is diving into a premium editorial analysis of how public language, expectations, and authority around addiction are actively shifting right now, and why those shifts matter so much.
Section 1. A shift in authority.
We really need to start by wrapping our heads around this quiet information revolution. It has completely redistributed who holds interpretive power. Today, no single institution controls the definitions of addiction or recovery anymore. And the wild thing is, nobody planned this. There was no official handover of authority from treatment centers to search engines or online forums. It just happened because information became hyper-abundant. So today, a counselor might have formal authority, sure, but a digital creator? They have emotional authority. A peer group has social authority. And AI systems provide informational authority. The public is taking the wheel when it comes to interpreting its own distress.
Section 2. Listening to public questions. So how do you map this unseen landscape? Well, the researchers at ClearBound didn't just crack open clinical textbooks. Instead, they aimed their focus directly at the public's actual curiosity. They realized that to understand modern patients, you have to look at the exact questions they're privately asking the internet, long before they seek formal help. To do this, they used a strict Cartesian method. Basically, instead of taking a massive, messy public claim at face value, they break it down. First, they detect recurring signals across the web. Then they decompose them, pulling apart the factual claims, the value judgments, and the underlying fears. And finally, they compare how these issues are framed across completely different digital communities.
Take a look at a question like this. When you really look at a query like this, you realize it's a deeply personal search for meaning. When someone types this into a search bar or asks an AI system, they aren't looking for a sterile dictionary definition, right? They are actively trying to make sense of a really painful, complex dynamic playing out in their own living room. And they're using digital tools to literally gather the vocabulary to do it.
And by analyzing massive volumes of these questions, we can watch emotional and vocabulary shifts happening in real time. Notice how this specific question moves from a clinical term to a highly personal, gut-wrenching dilemma. The specialized vocabulary of recovery has completely bled into the mainstream. It's becoming the everyday language people use to explain struggle, responsibility, and identity to themselves inside their own homes.
People are actively using online platforms to build complex narratives about behavior way before they ever talk to a professional. A question like this shows them trying to unearth the hidden motivations of someone they love. AI systems and online comment sections are acting as this giant 24/7 sounding board for their private, iterative uncertainty.
And these raw human question fragments, they reveal exactly what labels and assumptions people are bringing right into the counseling room. We are seeing a massive trend of self-diagnosis and self-classification here. Because when the public asks these questions online, the answers they stumble upon often dictate whether they even think professional help is necessary in the first place.
Section 3. 4 key conversational shifts.
By tracking these public inquiries over time, ClearBound identified some major interconnected shifts, and the defining one is this. Professionals now have to operate alongside algorithms, influencers, and personal data. Under the old model, doctors and institutions were basically the sole gatekeepers of information. In the new model, that authority is completely distributed. Now, this decentralization is incredible for reducing shame and expanding access, but man, it also creates immense fragmentation.
The report outlines these 4 key puzzle pieces. 1, the conversation starts way earlier now. 2, because recovery language is accessible, families are arriving super prepared. 3, that language is now totally mainstream. But 4, and this is the kicker, more information hasn't produced widespread agreement. It has simply changed the baseline of patient intake. Let's look a bit closer at those last 2.
Families are increasingly doing their own heavy research before the person struggling even enters counseling. They're reading reviews, binging intervention content, asking AI for conversation scripts, discussing boundaries, the whole shebang. And while this incredible level of preparation can absolutely reduce a family's initial feeling of helplessness, it can also dangerously harden their interpretations. A family might march into a clinic with a diagnosis, a treatment plan, and a whole theory of who is to blame already completely locked in place.
So what you really need to take away from this is that access to more data just allows people to find rock-solid support for highly competing, totally fragmented positions. One online community might preach that strict abstinence is essential, while another insists that's toxic and rigid. One source frames medication as life-saving recovery, another calls it continued dependence. Counselors today are literally walking into a crossfire of fully formed, totally contradictory public opinions.
Section 4. Understanding research limitations. Now, to actually use this intelligence effectively, we have to clearly define the boundaries of the research. This report is an analytical tool. The researchers strictly separate online visibility from clinical truth. That is a vital distinction. Just because a claim is super visible online and shaping public expectations doesn't mean it's clinically proven. Conversation analysis is about understanding expectations. It treats digital visibility as proof that a conversation is happening, not as proof that the claim is medically sound. This quote is such an important reminder. Vocabulary is shifting at lightning speed across digital spaces, but that doesn't automatically mean underlying real-world outcomes are changing. An idea might spread like wildfire online and be hugely emotionally influential, but still not be statistically representative of the broader population's actual recovery success rates. These limitations, they're actually strengths. They keep our focus exactly where it needs to be, on the fluid, evolving nature of how the public makes meaning. We have to remember that digital visibility is uneven. It often overrepresents the loudest, most distressed, or most commercial voices. Knowing this keeps us grounded. It prevents us from overstating the data and ensures we use these insights as a compass to navigate expectations rather than a map of clinical reality.
Section 5. Applying the insights.
So how do treatment providers, nonprofits, and communicators actually use this stuff to improve care right now? Well, if we know people are already arriving with labels, the important thing is figuring out how those labels shape the stories they tell themselves. Integrating specific intake questions like the ones you see here changes everything. By asking these, professionals are no longer just assessing symptoms, they are actively assessing a client's information diet. Asking something like, "Where did that explanation come from?" directly addresses the fragmented digital authority they've been consulting. This illustrates a massive shift in the professional's role. Our duty has evolved from merely dispensing information to expertly untangling the information families have already consumed. Think about it. Families can be highly informed but still profoundly mistaken. They can be fiercely divided, yet totally acting in good faith. The professional conversation now has to start by figuring out which conclusions are shared, which ones are contested, and what vocabulary is being completely misunderstood. Ultimately, the next addiction conversation is already forming right now out there in the digital waters, way before it has a settled clinical name. To be effective, educators and providers absolutely must be willing to hear that conversation, decipher its nuances, and understand its origins before trying to speak into it. As the report concludes, better addiction communication begins by listening closely to the questions people are already asking.
To discover the rest of these paradigm-shifting findings, I highly encourage you to explore the full report from Clearbound. You can read the complete Addiction Conversation Report 2026 at clearbound.org. So I'll leave you with this provocative thought. If the conversation about addiction has fundamentally changed, are you still using the old vocabulary to try and heal it?